Hi, this is Shannon with Chronic Pain Hacker here. I just wanted to make a quick video and giving a shout out to Re+active Wellness Clinic in Los Angeles. I have been taking some physical therapy and wellness type classes online via Zoom, and it has been life-changing. This is the best physical therapy slash occupational therapy slash psychological slash social, just in many other categories. It's just been amazing, and they can tailor each person's individual workout. Most of the physical therapy or physio places I've been to, let's say in Oklahoma and Texas, are doing the same standard exercises. And frankly, I could just do that. I go to Google and get those exercises. So I always felt like they weren't really helping me. So this is the most creative program that's out there. And if you have any type of neurological condition that is really hard to treat, I really recommend this place. I, for one, have functional neurological disorder, which I've had for about 40 years, but was misdiagnosed and only got a diagnosis in 2015 when I went to the Cleveland Clinic in Ohio for a second opinion because I didn't feel the neurologists in Oklahoma and Texas really, I knew there was something else wrong and we weren't getting to the bottom of it. And even then, when they diagnosed me that, they didn't go into, hey, we found out you do not have epilepsy, you have non-epileptic seizures, but they just called them conversion disorder and sent me on my way. I did do a chronic pain rehabilitation program there, which did help, but the neurologist just kind of dismissing me and saying, oh, you have conversion disorder. And he also called them like pseudo seizures. And I was like, oh, great, this guy thinks I'm just faking it. And in a way, so went back to Texas, suffered for another probably 2 years, until I found a movement disorder neurologist close to my house who mostly handles Parkinson's patients, but she also had some functional neurological experience. And I've been going to her ever since, so maybe the last 6 or 7 years. And she's amazing, and she really gets it. Unfortunately, there's not really a cure for functional neurological disorder. There are a lot of tools that you can use, but meds aren't all that helpful. Some are. Some anti-seizure meds are helpful if you can put up with the side effects. For example, Topamax, which is an anticonvulsant, did help a little bit, but it just made me a zombie, and I just couldn't continue to stay on it. So yeah, there are a couple things during really, really bad seizures where I have to use emergency medication, such as anti-anxiety medicine, such as Xanax or Ativan. But most of the time I can get away with hydroxyzine, which is actually used for allergies, but can also be used for anxiety. But most of the time I try all my tools first before I even look at any medication, and such as meditation, breath work, vibration, pacing, wearing abdominal and back brace support, compression socks. Compression has been a game changer. I have 4 compression blankets, and I have compression lap blankets. So even in the car, no matter what room I'm in, I have a compression blanket on me. At at all times, sort of as a preventative, but I have a heavy 20-pound one I use when I'm having a bad non-epileptic seizure, which which I have convulsions, I can't say that word, and so I use this 20-pound weighted blanket, and it will really help the muscle spasms and jerks, which can be pretty bad during the seizure. And after the seizure, it leaves me wiped out for about 4 hours. It just depends on how long the seizure lasted. Some days they're so bad it runs my whole day, and that's, all I can do is sleep or rest. But I don't have too many of those really bad ones anymore because I'm using my tools as preventative, doing guided meditation every day, breath work. I mean, I have to do this stuff every single day, and if I don't, I'm pretty much guaranteed a seizure. And a lot of people ask what my triggers are, or how long do I have as a warning sign before I have a seizure. And it's usually my right eye will start twitching. That's typically what it is, but lately a new one has started where I get really bad cramps in both feet, in the arches, because the muscle spasms and the jerks, I can tell, are slowly starting, and it's like they go from the feet up. So that's why I feel it in my feet. The other one is a migraine, or an aura. I don't know how you say that, A-U-R-A. Vision gets double vision. It gets blurry. I can't focus. I have trouble opening my eyelids sometimes. Sometimes my tick-like, it's not Tourette's, but it's very similar, where I just compulsively start going, no, 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 or something of that sort, and I can't control it. And my therapist said typically the no, no, no is me trying to tell my body to not have a seizure. So one of the other speech problems and trouble swallowing are some other early warning signs that something is about to happen. Luckily, I have enough warning. I can always get to a safe place. I like to be in the fetal position, laying on my side, surrounded by pillows, so I can try to minimize the thrashing that goes on with the convulsions. And they really do look just like epileptic seizures. And really, the main difference is that typically non-epileptic are only on one side of the body, so they are on my right side, and sometimes it causes paralysis. So during the seizure, and even sometimes after, my entire right side will be paralyzed. So like I said before, it can be minutes to hours before I get the feeling back on the right side of my body. And that's why after I have a seizure, I have to use a wheelchair pretty much for the rest of the day, because my legs are just so weak and my muscles are so fatigued from the muscle spasms and jerks. Lastly, I think I'll do that for another video. I do have some neck issues, like cervical dystonia, but that's another diagnosis. That's a long explanation, so I'll do that in another video. But if anyone out there has functional neurological disorder questions, it's also called FND as an abbreviation. Sometimes it's referred to as PNES seizures, PNES, which is like psychogenic non-epileptic seizure. There's one called NEAD, NEAD, non-epileptic attack disorder. So depending on what country you're in the United States, they used to be conversion disorder, and now the diagnosis code should be updated to say functional neurological disorder. But I know in Europe, the term NEAD, the NEAD, is used a lot. And I want people to know the seizures, the speech problems, trouble walking, that all falls under this big umbrella term of functional neurological disorder. But you can have various other diagnoses on top of that. For example, my cervical dystonia in my neck, which now I'm starting to get it in my entire body. So I'm getting it in my hands. It's very hard to hold a pen or utensils sometimes when my hands are shaking. So those all fall under the umbrella of functional neurological disorder, but they do have their own diagnosis. So this is all for now. If you have any questions, put it in the comments, or visit my website at www.chronicpainhacker.com. Thank you.